So before that is then organized. As mentioned, my name is Isabel Suryo Mataram. Can I just see whether people can hear me? And then if you can hear me, can you please raise your hands in the audience? Everybody, I see some people are not raising their hands. Okay, very good. Thank you so much. So my name is Isabel Suryo Mataram. I am actually originally from Indonesia. So then I think you can see that then from my name, and then people always sometimes guess or think that I am from India, but and then I still have to correct them every time that it's an Indonesian name. And then when I heard about this conference, and then I was invited to come, my immediate reaction was to say yes, of course, because I love Kuala Lumpur, of course, I love Malaysian food. And then, of course, it's very close by home, hoping that I can visit my family. Unfortunately, I cannot be there with you this time. Hopefully, then for the next time, that the organizer would then be willing to invite me again. But today, what I'll do, then I'll go very quickly, hopefully, into this presentation. So the presentation is then about cancer prevention and cancer control. I work in I'm leading then the whole data collection and estimation for global cancer data. And then I from my side, of course, truly believe that in order to drive policies, but that not only policies, inform local action and global kind of movement to reduce cancer burden, we need data. And then I'll show you what data that we have. So why is there then interest in cancer? So cancer, I was looking a little bit into data like from 50 years ago. And then at that time, cancer isn't really important. And when I was doing my medical degree and so on, we look at at a completely different landscape of diseases then. And I remember coming then to do my first studies abroad. I was really then not looking into becoming a cancer person, but much more looking into becoming an infectious disease person or a maternal and child health person. It all changed because then in Europe at the time, cancer was already the first most common disease. And then when we are looking at the disease, the data today, so this is data on causes of premature death globally. And then when you see then the color, so countries colored as blue or light blue, it shows that cancer is at least the first or second cause of premature death. Then when we immediately then looked into then countries, for example, where we are or where Malaysia is, but I know that there are other people coming then in the region. Malaysia is then colored light blue there. So cancer is then the second most common important cause of death, the second cause of death. And then it's not very different, it's not very far off from cardiovascular disease, so it's just really below it. And then that's what you see then with many other countries. My country, Indonesia, you see exactly kind of the same pattern as Malaysia. That's true as well for Laos and then for Vietnam. But then in Thailand, you see already then that difference. In China, I know that some of you are coming from China, that cancer is already today the first cause of premature death. And then the importance of cancer within the national kind of health system or programming is taken up and then is realized by many of the local governments, of course, and policy makers. One good example is then this conference itself. It is there because then locally there is an acknowledgement of the importance of cancer, and then that we need then to gather experts and our discussion and our narrative together to really then tackle and control cancer nationally. And that's not only happening nationally. If we see globally, completely not even linked into then the health sectors, just global sector in general. looking at the UN declaration, where then we are seeing in the goal number 3, so this is then the Sustainable Development Goals, cancer is then listed as one of them the target or the goals that has to be tackled then within countries. And that's also true then for WHO, so the World Health Organization. There's more and more than interest in cancer. It started off with the global strategy or initiative to eliminate cervical cancer. After that, we saw very quickly that they are trying to tackle other cancer types, like childhood cancer. There is then the Global Initiative for Childhood Cancer, and then more recently, Global Initiative for Breast Cancer. So everyone is looking now into cancer and the cancer problem. So what is then the biggest problem there? So we know cancer is a problem, it's an important cause of the death, but it is also an important cause of suffering among the population. So in IARC, what we are then trying to focus, of course, then into then the different aspect of cancer in prevention, in the causes of it, in the implementations of programs in countries. What we are then kind of trying to tackle this is then through the data side. So we collect, analyze, and interpret, but also disseminate cancer data. So then action and strategies within countries can be informed through this. We work really with partners within countries. We work a lot as well than in Malaysia, for example, but mainly we work through an institution or a data collection agency which is called the Population-Based Cancer Registries worldwide. And then we truly believe that this population level data, it doesn't have to be national, it has to be representative of the population for which the data is collected, is then key to kind of inform this cancer control. The big problem is, again, just to show you a very simple map here in yellow, this is then how it should be. Every country in the world should have good data to inform their planning and strategy, but that's not the case today. We see then some regions, for example, North America, okay, that's only 2 countries, but 2 big countries there, they are covered and then they have good local data to inform their cancer control. Europe is also doing well in that sense, and Latin America with some exception. But if we see, for example, Asia, if we see Indonesia, or if we see Malaysia, there could be a lot more done to improve the situation. At the moment, we really are still limited in terms of high quality data to inform cancer action in our countries. So what kind of data do we have? So this is then just a global map showing how the data, how we estimate kind of then incidence, so the number of new cancer cases in countries. So for example, if then we have the color blue then presented there, you see then for all Nordic countries, but also Northern America, that's true also then for Australia and New Zealand. We have then real data for a long period of time, so we only then have to do a very short prediction of what was seen, and then those really give you good estimates of the most recent burden. We see countries that are then in blue, where then you have population-based registries, but then only covering a smaller part of the countries, where then you kind of then project that forward. In most of the European countries, we use mortality and a combination of mortality and incidence, because generally there are both, and then use that then to estimate nationally. And then in all the red ones, we have then very little or no or old data from the country to inform that estimations. And that again is the case for Malaysia, and that's the case again for Indonesia. For mortality, it's the same case, so to estimate then death, to have a bit of an idea of cancer death in the country, we are seeing the same thing. So you see the whole Americas almost, so North America, Central America, Latin America, there's really this tradition of collecting good mortality data, knowing what is the cause of death. That's true again in almost all Europe, Russia, Australia, even South Africa. This mortality data and high quality mortality data that covers usually national data, so that exist. And again, well, then it's yellow. We then have to do a lot of modeling based on really poor data to do this work. And very little countries in the world actually have no data at all. So when we then put together all this data, the idea is then not to use it for ourselves. It's useless if we put it then somewhere here in an office in Lyon. So the idea is then to give this and then give it and make it available for all, for them then to use it either then for research, that's what I most use it then for, but also then for informing cancer control. So we try to make it as well as user-friendly, as nice as possible, so then people are using it. And all my slides to come now are then going to be based on this website. Again, as mentioned before, the data come really then from cancer registries, and even in countries we see that there is this big interest of having then a proper and better cancer registries within the country. So these are then the data that we've been collecting over the years. So we have data that we collected actively since 1960s, but then of course countries give us then data before that. So in around 1960s, that's I think for many of us are from or at least the years of birth. We had then around 35 populations. We have then much less countries because some countries, for example, collect data for different populations, for example, for different race or ethnicities within the countries. So this is what actually we had previously from Malaysia, where then data are actually available for the Malays, for the Chinese, or for the Indian subgroups of the population. We also then have a bit less countries, because in some countries what they do, they put cancer registries in different parts of the country, so then they get representative pictures of the country. And then if we see today, we receive data from at least almost 1,000 population more, where then 600, close to 600 of those data are of high quality and which we can use then for these predictions. So just to go over very quickly then on the data itself, in 2022, so we are always then a bit delayed because the data are kind of lagging a little bit. We estimated 20 million of new cases within a year only of cancer. Lung cancer is the most important cancer that we see today for both men and women combined. Breast cancer comes second, but then if you look at the 5 top cancer, you see almost 50% of all cancer. If we see that half of those new cases die, then at least then in 2022, so in a year we see then almost 10 million then death from cancer. But then we see also a lot of progress in cancer control or treatment and management especially. So today we see a growing population of survivors. So prevalence are then survivors of cancer. We're today then seeing at least 53 million. So this is a country of cancer survivors who need then continuous care, but also psychological support, etc. Just to make it easy, we often then present this in terms of what we call cumulative risk. And then I think everybody has heard about this indicator. So this is then a graphic that shows, for example, for 100 people, if then there is then, for example, 100 people sitting in that room, there's 20, or this is then 22 actually, then men would be diagnosed with cancer. So cancer is in 1 out of men will develop cancer in their lifetime. And that's not so different in women. Actually, it's a bit less. If you see then the red people there, then there's 19 women. But then if we kind of then round that up, it's again 1. If there is then 5 women in the room, 1 will then develop cancer over their lifetime. So it's big, it's important. If I'm thinking I'm sitting in over dinner with my family, that's five, and then you'll then get one of us will get then cancer for their lifetime. So it's an important disease. And then if you see mortality, just as before, half of those who were then diagnosed will die of the disease. So it's really too much death. And we know, as then presented previously, cancers are preventable and cancers are also detectable at an earlier stage, so they can be treated. And why is this then cancer becomes so much then more important? Partly it's related then to improvement of the human development in general. So human development include then increasing life expectancy. So increasing life expectancy in general, because then people are getting older, people don't die because of cardiovascular disease or infectious disease, then people die from cancer or from other diseases. And then that's why then the increase of then cancer, that what we see then globally. And then we often then kind of then look into then different cancer types, increases in terms of numbers and burden throughout the optic of this human development index, because at the end it also links to a lot of lifestyle changes, etc., etc. So we can predict this. We see how human development moves, so we can also predict how cancer will then be in the future. So I'll go through then different patterns for men and women, just to give an idea what are the most common cancers. So for example, men, we see then half of the cases globally are then happening for men, so 10.3 million new cases occurred among men. Lung cancer is then the most important cancer, but prostate cancer is not coming far from it. For death, it's a bit more than half of the death are then from mortality from cancer in men. Lung cancer is again the most important cancer, but after that it comes then liver cancer, it comes also stomach cancer there. And again, then I have then to say, lung cancer, it's difficult to treat, the prognosis is poor, that's true as well for liver and stomach cancer, but they're all preventable cancers. And then if we see prostate and colorectal cancer there, they're all treatable cancer. So if we're looking into this, at least half or even more of the cancers are either then preventable or treatable. So we can reduce the burden a lot. And then if we see globally, this is then the global map of what is then the most important cancer in each of the countries. So then just picking up Malaysia again, not then to put you into the spots. But then in Malaysia, and that's true again then for Indonesia, I can then pick up Indonesia as an example. These two countries, lung cancer for men is then the most important cancer. And we know, and then I think there is now concurring talk in the meeting about then the importance of tobacco smoking. Tobacco smoking will prevent a big proportion of probably almost 80 to 90% of lung cancer. And then if you're talking about cancer overall, 20%, so one in five cancer can be reduced just by reducing then tobacco smoking. The other cancer is then prostate cancer, that is then common in a lot of countries. We know then the treatment then for this cancer, and then we know actually the survival is very, very, very good. Almost 100% of men who are diagnosed with prostate cancer survive. Liver cancer, colorectal cancer are then the other common cancer in different countries among men globally. If we see mortality, lung cancer immediately get then into the top. Prostate cancer is not so dominant or prominent anymore, again then pointing to the role of cancer prevention and how much it can then do to prevent unavoidable, unnecessary death in the population. So I want to go through just very quickly on Asia, my favorite region, of course. I picked up then countries here. I just want to kind of come with one message here. So Japan, Korea, Singapore, so this is what we call then kind of the higher income countries in the region. They have then much bigger kind of incidence rate, so the number of the new cases in the countries. If we see Malaysia, it's somewhere in the middle. Indonesia is just below Malaysia with 150 per 100. So there's a big difference in incidence, in number and the occurrence of new cancer. But what is then kind of, I think, obvious here in terms of mortality or death from cancer, it's almost the same. If we see Japan with 300 and then Japan with 100, so 300 out of 100,000 people get cancer, but only 100 of them die in Japan. That's the same as well if you see then Korea. But then if we see Indonesia, for example, about less than 150 get cancer, but then if you see mortality from it, 100 of them. So there's so much more people dying in comparison to the number of new cases than in the country. There's something that is working in some countries and some things that's not working in some of the other countries. Next, turning to then the females, about then 10 million again in females. Females then having new cancer globally, and this is then especially for breast cancer. That is then the most common. Almost then a quarter for all cancer in women is then breast cancer, followed by lung and colorectal, and that's really true as well then for the mortality. Again, we know what the cause is, what we can do then for these two for these cancers in general, and cervical cancer come not far from it. We know cervical cancer can be 100% prevented within a country. If we see globally, it's then pink. Pink is then the color. We have data for 185 countries. This is almost 157 countries. In all of them, we see breast cancer as the number first cause of then new cancer. There are some countries with cervical cancer and lung cancer, but that's the minority. But still, breast cancer and cervical cancer are then the two cancers that are really, really, really important then for women. And that's true as well then for mortality. So breast cancer then is important in Malaysia and in Indonesia, but then that you see then a picture of then some of the other cancers. So liver cancer is then coming as well then in some part of the region, and as well as lung cancer, as women are now in many, many countries picking up smoking. This is again then from Asia, and again that same picture or key message arises. Japan, you have very high incidence, but if you see then mortality across then Asian countries is almost the same. They're doing really well in detecting cases early and in managing those cases, that the survival, so they don't die from the cancer, is then much better than all the other countries that you see here, including in Malaysia, that then in terms of then incidence and mortality for female is then going higher than what you see then in men. With the data that we have, we can also do a bit of then future prediction, just to then to be able to plan how many cancer cases and how many cancer deaths that will observe. And then what we're going to see is just kind of an aggravation of it. It's going to get worse. We're going to have more cancer cases in the future. And if people think 2050 is far, far, far away, 2024 is already then here actually. You're just seeing 25 years from now. A lot of us are going to see through 2050. The cases will increase, then it's not double, but it's almost, we're going to see this, and we're going to see this everywhere. And then the other thing that I want to show, there is increases that we're going to see. So this is then the increases that we're going to see in different level of countries based on their Human Development Index. So we're going to see in terms of number, it is then still going to be highest in very high HDI countries. So this is then a lot of the European countries or the US, etc., including Japan and South Korea as well. High HDI countries, some of them the countries in Asia then are here. You see that then growing as well. But then if we see then countries that are in medium or high HDI, so this is then our countries here, the number of cases that we will see in the future, it will double. It will increase by 100%. So then in terms of the proportional or relative increase, these are then where the countries where we're going to see this increase most. And if you see it in Africa, it's really going to be increasing more, even more than double. So just then to conclude to my talk, cancer is becoming an important disease burden, and then I think everybody acknowledges this, and that's why we are all in this room. Maybe then some people need to be convincing, but then I'm hoping that the data can be used and for that to do something about cancer today, now. And then what is then more importantly, as I hope and I showed, that the burden is growing. We're not going to see a decrease in cancer burden very soon, unless then we do something very quickly. And many of these cancers are preventable, and we know as well how to prevent them and how to treat these cancers. What then I want to say as well, data I hope provide the information that's needed to plan. We now know which cancers that are then important. We now know as well as in where we are going with the cancer. And then hopefully we can use this data as well to monitor and to evaluate how we are doing with these cancer control strategies moving forward. And at the end, we're doing this not for ourselves, but we are doing this for our families, for our community, for our society, and for our country. Thank you.